have reviewed the physician's order and the patient has been diagnosed with pneumonia. There is a nursing diagnosis of impaired gas exchange. There is inflammation associated with the lungs and is leading to impaired gas exchange for the patient. Today, the patient is a 50-year-old female admitted into the hospital with chest pain when breathing, fatigue, nauseous and vomiting, shortness of breath, fever, and tachycardia. The physician has written orders for 2 liters of oxygen with a nasal cannula and has prescribed Tylenol 325 milligrams PO every 4 hours as needed. Hi, my name is Whitney. I'm going to be your nurse today. Let me just wash my hands before we begin. I'm washing my hands for at least 20 to 30 seconds. All right, can you please state your name and your birthday? Good. I'm just going to confirm with your bracelet. And that is correct. I understand you have come in today because you have been diagnosed with pneumonia and impaired gas exchange. So today I will be assessing your respiratory system, gastrointestinal system, and cardiovascular system. Is that okay with you? Great, let's get started. After explaining the procedure, I then documented subjective and objective data during the patient assessment. Now let's get back to the patient to finish the physical assessment. For your respiratory assessment, I will ask you a couple questions to start off. How are you feeling right now breathing-wise? Oh, okay. So your main complaint is that you're feeling short of breath and it is hard to breathe. Okay. With that complaint, I am going to check your oxygen saturation with the oximeter. Oh, you are 90% even on a 2-liter nasal cannula. So let's raise the head of your bed. The main intervention is to raise the head of a bed to make the patient feel comfortable. Now you have your 2-liter nasal cannula on you with an elevated head of bed, and I have positioned you so you feel comfortable. This is because it will help minimize the shortness of breath, break up your secretions, and raise your oxygen saturations. I'm reassessing. Your oxygen saturation is now 98% because of that intervention of raising your head of the bed. For your gastrointestinal system, I will ask you a couple questions. I read in your chart that you have been feeling nauseous and vomiting. So when was the last time you have vomited? Okay, so you have vomited within an hour ago and you still feel nauseous as of right now. All right, so I will need to do an abdomen assessment. Is that okay with you? Perfect, let's get started. I will only uncover what needs to be exposed. And I'm going to listen to your abdomen for any bowel sounds. Your bowel sounds are hypoactive in all 4 quadrants. This is due to your recent vomiting. An intervention for your gastrointestinal system would be to teach you deep breathing exercises and encourage adequate rest. With these interventions, it will help relax your muscles, and it will help prevent you from feeling nauseous and overall improve the quality of your life. Now we're going to assess your cardiovascular system. In your chart, it does state that you have tachycardia, your high heart rate. So I will be checking your pulse. I'm going to check them on both of your arms for 1 full minute. You have a radial pulse of 110 beats per minute. It's brisk and bilateral. Now I'm going to check your temperature because you have been feeling fever and pain. So I'll just check your temperature to make sure. Oh, your temperature is 102.4 degrees Fahrenheit. For this intervention of your cardiovascular system, I will administer Tylenol per physician order. We will administer Tylenol 325 milligrams by mouth every 4 hours as needed. This will help reduce your fever and discomfort. So let me go get your medication and I'll be right back. All right, I have your medication, but for safety purposes, can you please list your name, birthday? Oh, that's correct. And I will verify with your bracelet just to confirm. Correct. And do you have any allergies? No allergies. Okay, so here's your Tylenol of 325 milligrams by mouth every 4 hours as needed. Now that I have assessed your respiratory system, gastrointestinal system, and cardiovascular system, how do you feel with the interventions that have been implemented? All right, let me wash my hands before I give you your call light, then you can be prepared for discharge. I would document that I elevated the patient's head of bed and that patient education and breathing exercises were taught and given. I would document that I administered 325 milligrams of Tylenol by mouth per physician order. I would also document that the patient's oxygen saturations have went up from 90% of oxygen via nasal cannula now up to 98% of 2 liters of oxygen from the nasal cannula. And the patient did tolerate well with all interventions. This is for a patient with pneumonia and her impaired gas exchange.